Welcome back to Nursing with Bonomi, where we put the page into practice. It's Nurse Nate, and today we're going to talk about progress notes for skin alterations. Okay, so progress notes are one of the hardest things with nursing to try and figure out how to write. So today we're going to take 3 different types of skin alterations you are likely to come across and talk about how to write a progress note for those. And I'm going to put pictures of the example typed up so that you can take screenshots of these and use them if that is helpful for you. What you want to put is the description, the size, if applicable, what you did to take care of it, that you notified the family and the practitioner, and that's about it. Skin tears. So skin tears when someone with really fragile skin bumps up against something and their skin just shifts up. This is what a progress note could say as an example. Patient sustained skin tear to left forearm while self-propelling in wheelchair. Area was cleansed, approximated, and secured with steri strips. Patient denies pain. MD and family notified. Just like any other change in condition, you always have to notify family and physician, or practitioner, I should say. So the portions of this progress note that are important, you're putting what happened, what was the injury, it was a skin tear. Where is it located? The left forearm. How did it happen? She was wheeling around in the wheelchair. What did you do about it? You cleaned it and put steri strips on it. If the patient is alert and oriented, you could also put that patient was educated about wheelchair mobility safety. So there you go. Another one you may come across is if you find a small little open area, for instance on a buttock. Example. Small open area noted to left buttock measuring 1.5 by 2 by 0.1 centimeters. Wound bed red in color. No signs and symptoms. Infection noted. MD or practitioner and family notified. New order for zinc cream, BID, and PRN received. Okay, so we have what it is, how big it is, where is it, what did you do? MD family notified. On a side note, one thing you don't want to do is document something as a pressure wound unless you've been told that that's part of your job description. So just as like a floor nurse, just because something is red or it's even open and it's on the bottom, that doesn't mean it's a pressure wound. There's specific criteria for that. And once you document that something is a pressure wound, there's a whole spiel of stuff that goes along with that. And heaven forbid, it may not have actually been a pressure wound, and then all these other things happened just because that was put in the medical record. So it's always safe to just put small open area is the safe thing to put, because you're not diagnosing anything. So if you have any questions about like specific types of skin issues and how you might treat them, I have a video. I'll try to put a little card right there about how to take care of specific types of wounds. And the third one we'll talk about that is probably up there in the 3 most common skin things you're going to get is a fungal rash. Those are usually located under abdominal folds, under the breast, and in the groin, where there's moisture that builds up. So you can say is scattered fungal rash noted under bilateral breasts. MD notified. New order received for nystatin powder BID times 14 days. Family notified. Done. So these are 3 like sample notes to get you a head start. Now, according to your facility policy, you're probably going to have to also fill out what's called an incident report. That's a whole nother topic, and that varies by facility. So that's just facility specific. And your manager or charge nurse or supervisor or whomever will gladly show you that one. So those are some examples about how to document skin alterations. Please leave me questions or comments in the comments down below. Please subscribe if you haven't already. Thank you guys so much for watching our channel and supporting us. And stay tuned for our next video where we continue to put the page into